This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and I am delighted to welcome two guests from the Owen Family Health Team today. And hopefully I get the titles and names correct in the pronunciation, but it's Rona Cobean, correct? Rona is the Executive Director of the Owen Family Health Team, and Amanda Wright, who is here because you're the manager for programs and services, correct? Yes, got that right. Good stuff. So I'm delighted to have you both on the program. It's been a while since we've talked about the Owen Family Health Team, and I know things are changing. Rona, you're in a new position from, I think, the last time we had a conversation, for sure.
Yes, I am.
Yeah, that's great. So thank you very much for being on the program. One of the things that sometimes gets a bit confusing is the difference between the family health team and the doctors group. So I'm wondering if you could clarify, and you guys get to pass the conversation back and forth about the difference.
Sure. So the family health team is made up of allied health professionals. So pharmacists, dietitians, occupational therapists, nurse practitioners, nurses, social work, and I'm hoping I'm not leaving anybody out. And what we do is we augment the care that the physician group gives. So we are two separate entities. There's the physician group, which is actually in two groups, Owen Sound Medical Associates and the Georgian Bay Practice Associates. We work alongside them to help their patients with care. So we do a lot of chronic disease management, sort of a lot of health teaching, and that's what we're here for. So we are two separate organizations, but we work side by side, and we look like we're one because we're all in the same unit in the building.
And that's helpful to understand. So together, between the groups, you actually offer a package of care.
Yes, we do.
To people by working together. So, which is great, actually. And we're going to learn more about those programs and services as we go forward. So the funding for what you offer, where does that come from?
And actually, we have new funding model that started in October. We've currently, up till October of last year, we were funded by the Ministry of Health, which has just changed to now Ontario Health is who's funding us. So all of our funding comes from Ontario Health.
So, and that's changed. That's a new funding model as well.
It hasn't changed significantly, but it is just a different funding spot.
So, just to get into a little bit more detail, so the programs that we're going to be discussing, do people have to pay for those programs then?
Yeah.
So this is funded because you're funded through Ontario Health. So, yep. All right. Well, I went into online and I pulled up the list of programs and services. There's a lot that you provide. So I'm wondering if you can go through what you offer, and then we'll talk about the logistics about how patients can access those services, even if they're unattached, meaning not attached to the family doctor group. Sure. So who wants to go forward with that?
So we offer a lot of programs here, as you said, Carol. We do offer some of our programming just to rostered patients. So we do have diabetic nurses that help out with diabetic education. We have a diabetic foot care clinic for patients that are rostered to the family doctors here. But we do have a lot of programming that we are offering to everybody in the community. So we have a lot of online classes. We have some in-person classes that I'm going to kind of go over, and some support groups as well that we have that are just going to be starting for both unrostered and unattached patients.
So someone who is watching the program, they don't have a family doctor,
Mhm.
even in Owen Sound, they could participate and sign up for your programs. That's what you're really sharing with us today, which is wonderful. Yeah, yeah. So if they're interested in a program, then say they're like me, they've looked it up, or after today's program, they know more. How do they even get their name on the list, or how do they find out more?
So they would call us here at the Owen Sound Family Health Team now. Our programming phones have changed, so it is a little bit easier just to get a hold of us here at the Family Health Team because it's the same number for both the doctors groups and the Family Health Team as well. We've made it a little bit easier that they would dial option 6, and that would help them kind of work through talking to just the programs and services receptionist so she can help them get signed up for some of our programs.
So that number 6 is really important then.
It's very important, and then it will bring you through a lot of our different practitioners as well. So if you're looking for certain things like we have our cervical screening clinic, if you needed to talk to somebody about a dietitian, it will help guide you through.
Excellent. So let's go into a bit of detail about the programs and also the ages of programs that, because I think you offer across a variety of ages. So take me through.
We do. So I'm going to kind of start with some of our programs and services that we have that are for our unattached patients. So we do run an unattached cervical screening. So people that require that preventative care screening of their pap smears. So we do offer that to anybody that is eligible between the ages of 21 and 70 at this time, as long as they're within that time frame of the 3 years. And if they have no family doctor here in Ontario, then we would have a nurse that would see them. We also offer a unattached newborn program. So those referrals come after a baby has been born. We have our nurse practitioner and a couple of our nurses that work alongside of each other to make sure that well baby visits are done for newborns that have come into the world without a family doctor, or the families do not have a family doctor that will take the baby on. We make sure that they get their vaccinations, that they're gaining their weight, and are able to access referrals if they need them to other practitioners in the community. And we also, prior to seeing the newborn, sometimes see prenatal appointments as well. So we do have a program run by nurse practitioners as well as nurses that we do see are women that are expecting and have no family doctor here in Ontario. So they are unrostered, and we would see them for their full prenatal care. And then generally we would see babies after they are born.
Yeah, which is a great service. So you offer care, and whether it is from local or anywhere, it doesn't matter.
So we do have some catchment areas because there are other community-based programs that might see people in Southern Grey or over in Bruce County. So our catchment areas for those programs right now is Meaford, Owen Sound, Georgian Bluffs, as well as part of Chatsworth.
And South Bruce Peninsula.
And South Bruce Peninsula.
We just added that.
Yes.
One, so.
Okay. Yeah. So you're expanding where people can come from.
We have been, yes, we have been. As we see kind of a need, we are moving over if there is another community that does not have access to those services.
Excellent. So you've taken me through the babies and the and parents to be. Take me along this spectrum now, because I noticed that you have a variety of programs for chronic disease, for aging, for mental health.
We absolutely do. So some of those chronic diseases like diabetes,
We've kept ourselves some notes.
Yeah, we have
Go through
diabetes,
some of these.
stress management, those types of things.
Yeah.
We have programming that is run by some of our dietitians, pharmacists, and our occupational therapists. So we have the healthy eating. So help lower your cholesterol. We also have healthy bones.
Yeah.
So this is how to live healthy with osteoporosis. And one of our quite popular classes is our Boosting Balance. So that's run by a few of our allied healthcare providers, our occupational therapist, dietitian, and our pharmacist. So what the class does is teaches you fall prevention, medication safety, good nutrition, how to keep our bodies healthy and have less fractures and falls as we age.
Yeah. So it really sounds like different team members contribute differently in the programming, but create that whole holistic approach to care. And it also sounds as if, I mean, your focus is prevention. It's to prevent need for more care by offering these programs.
Absolutely, absolutely. Prevention is usually our number one goal, but also maintaining a healthy lifestyle if you do have a chronic disease as well. A lot of the times with prevention, that's helpful if somebody doesn't have a family doctor. So how to stay healthy, how to get that good research-based education on how to have a healthy lifestyle.
The mental health programs you're offering as well. So tell me a bit more about those.
So we run a class for stress management. A lot of our mental health resources are being used here internally. We don't have a very large mental health department, so not a lot of staff on it. And so most of their resources are for one-on-one counseling for folks that are attached to the physicians here.
Yeah.
We do offer a stress management online class for mental health. And someday in our wish world is that we can increase that mental health team so that we can offer more services for those that are unattached.
Excellent. What other programs haven't we covered or that you'd like to profile? Or shall I ask questions about how you decide?
Well, actually, we have a new one coming on, a new online program, and it's talking about long COVID. And so since COVID started, we got knee deep into COVID throughout those first few years of it. And we now have a long COVID program, or a clinic, shall I say, for our folks that have a doctor here. So those folks that have those long-lasting symptoms, it can range from fatigue, it can range from headaches, it can range from just about anything. But there's symptoms that have sort of never resolved themselves since they have recovered from COVID. So one of our NPs has taken on this project, and she is excelling in it. And so we run a clinic, of course, as I just said, for our own, the patients that are attached to physicians here. But we are just starting an online support group for long COVID patients. And they can be anybody in the community as well. So it is on our website. And it is on our social media. And we're looking forward to get that up and going. It's coming soon.
What you're describing to me is the fact that the programs and how you strategically move forward with programs matches needs that are continually arising, that
Yes.
it's not a static program base at all.
No.
And that I think is so valuable to the community because health needs change, right? I mean,
for sure. Health needs certainly morph as time goes on, and we can recognize the differences. I know I sat in the programs and services manager role for I believe 7 years, 6-7 years, and the programs really morphed over those 6-7 years, and they're still morphing. So yeah, we try to keep on top of sort of like the latest of things that are out there and the needs that are in the community, and then, as I say, just sort of make our programming to match or meet those needs.
So you're offering a variety of program, you're adapting. How do you match the programs with our current population base? So you mentioned the COVID-19, there was an interest, a nurse practitioner had an interest, but you have programs, I think, that target certain age groups as well. The Aging Well program, for example. How do you figure out what to put into those programs?
So to be honest with you, it's really just like our clinicians, our staff see these folks every day. They're seeing what that need is. They're seeing in trends. So when they see those trends, we are matching the education for our staff here to go with those trends, and then developing. And to be honest with you, a lot of our staff have that education anyways, but they're sort of upgrading it and seeing the latest and the greatest that's out there, and then we're developing the programs from that.
Excellent.
Yeah.
Amanda, what are you hearing from the people who attend the programs?
I find that most of our clientele that do come, especially in our classes, because my office is right outside our classroom, I hear a lot of laughing and a lot of
People come out smiling because they feel that they've been empowered with knowledge on their own health, and they're making these great strides to feel well. And they also have a sense of community. So they're seeing other people that maybe are in the same boat as them with diabetes, or they're struggling with high cholesterol. And quite frequently we see these clients build some bonds and friendships and can kind of continue on and encourage each other to keep coming to different classes, or did you try this one? So very positive with our patients that we do see come out of our classes or with their appointments with certain clinicians. So
yeah. And what do you hear from those staff who teach the programs?
So our staff is very passionate about these programs and preventative care. I do actually come from the floor, so I was a program nurse. So a lot of the unattached programs with babies and moms and cervical screening were programs I was very involved with. I'm very thankful that we can help these clients and that we have the ability to reach out, and patients that don't have family doctors can still get care. And we're very thankful we're able to do that. So not just the rostered patients, but all the community patients.
You mentioned about, developing bonds, and we talked about a support group as a link for people. We've learned how important community connections are, especially through COVID, but it sounds as if as you're developing the types of programs, you're also developing that community connection for people ongoing, which is also a healthy thing as well. And I think that's so critical. It's certainly a key learning. We know what isolation did for people's health, mental health, during COVID. So having that opportunity for support, networking, or building bonds, I think is a plus to your programming for sure. So if I wanted to be involved in a program, can I only be in one?
No. And that's what does happen is we have clients that take one program and their friends, well, have you heard about this one? And the word of mouth gets around. So no, you're welcome to join as many programs as you feel necessary or that you would benefit from.
And we've had people that have been enrolled in a class, and the class might be 2 or 3 weeks long, and then 2 or 3 months later we may see them come back into that class because they really enjoyed it. They want to bring their friend with them this time, or they've really enjoyed it and they were like, I'm just going to go again to see if I can get any more information. And as we all know, we when you hear something a second and third and fourth time, you're hearing more things, you're hearing different things. So we always encourage folks that if they want to sign up again, come on back. We're here. So yeah.
So you offer a variety though. You mentioned about online and in person, but I also read that you also have videos.
We do.
recordings.
Yes.
Mhm.
So everybody has a different work schedule.
Yeah.
Sorry, Carol.
No. My healthy videos that caught my attention, right? Tell me about those.
So it was brought by some of our allied staff that want to meet patients where they're at. So because of everybody's different work schedules, family lives, just schedules, they want to be able to meet people where they are. So if they work during the day and can't attend a class, they want to be able to get that health knowledge out. So people can watch them at their own leisure. They can stop, pause, and go back if they need to get more information. So that was one thing that we had started over COVID, was making sure that those videos were available to our patients so they can rewatch them and be able to see them as they will, and not maybe have to participate in a class if they didn't want to, but still have that information.
Did you want to mention some of the videos? I don't know if you've got that handy yet.
We don't have
I
it right
do.
in front of us. We do. I was going to say we do have. There's a diabetes recording.
A recording on type 2 diabetes. I think there's actually a first part and a second part of that. I'm trying to remember some of the other ones because they I can't remember any of the other ones. Sorry.
So we do have stress management as well.
Oh, it's a recording.
So
Yes.
stress management is recording, and then it does have 2 optional live sessions as well. But those recordings can just help people through maybe a stressful situation, learning some different coping skills. They're having a tough time. They can just kind of review those pre-recorded sessions, and if they don't want to join the class, then yeah, they can do that. And I'm just having a look here.
Oh, the nutrition for a healthy pregnancy as well
Mhm.
is a recorded video as well.
Yeah.
Again,
We know that moms, when they're pregnant, they've got a ton of other things going on, and to be dedicated to sit down at a certain time for an online class, it just doesn't work. So pre-recording so that they can watch it at their leisure. Yeah.
I think recognizing the geography we're in and the different weather conditions, the fact that you can see videos, attend online or in person offers that flexibility and adaptability. We also know that transportation can be an issue for people. So that's what captured me when I saw about the videos as well as the other, because it seems to be meeting needs.
Yeah, sorry, COVID is what changed that world for us. Prior to that, we had every one of our classes were in person. So COVID changed our way of working, and we went to different modalities to get that information out. And again, as Amanda said, it meets people where they're at. If when they can do it, they can do it. If they want, if an in-person class works better for them, that's the route they go. If it's a recording is better, then that's the route they go. So it really did open our eyes and really changed our planning and programming here.
It's almost like you've planned a healthcare menu of programs and services that people can select what works for them, where they're at, which I think is it helps because it's getting the messaging out, right? That's what you want to do. Strategically for the future, what else do you have, Rona, in your dream list?
I have lots of things in my dream list. Funding is usually attached to those dream lists.
Oh, yes.
But
Yes,
yeah. I mean, I think we really want to start trying to focus a bit more on that unattached folks. There's so many folks out there in the community that do not have a family physician. And if we can help them in any way, shape, or form, that would be great. That is sort of where we're all like, and you'll see that across Gray and Bruce. Everybody's sort of going, all right, let's see what we're doing. And the other thing that we've just recently brought into for the patients of the physicians here is a palliative care support care navigator. Palliative care nurse navigator. And she sort of looks after those folks that are in palliative care, whether they be at home, and just sort of like monitoring them, seeing how they're doing, having that connection so that that patient has a one point of connection. They call into their palliative care nurse. The nurse will get in touch with the doctor or home care or whatever the case may be. We just started that within the last year. And, we would like to be able to expand that as well, to be able to include some unattached folks. But again, there's a funding constraint a bit there. So, but we're working on it.
So the opportunity to grow the programs and services certainly is there. Are you having concerns that we will have more unattached people in our area? We're hearing about physician shortages, and does that create a bit of stress on your part that, oh my goodness, how are we going to meet these needs?
Well, I think it does on a whole across all of healthcare in this area. I mean, we know that we have folks moving into the area, whether it be for retirement or whether it be for work. So we do have those people that are moving into the area, and we just don't have the capacity. We don't have the physicians. We have 21 physicians associated with our family health team, but they have, with those 21 physicians, there's 32,000 patients attached to them.
Wow.
So, when you then take there's how many more that are out in the community that are unattached, we're just sort of busting at the seams. So we need more physicians to come into the area to be able to help with that need. But is there something that we as a family health team can do? Of course, there's certain things that we can. We can try and help out. And that's where we came about with the unattached prenatal program and the unattached newborn program. Those folks that it's time sensitive, that they need to have, eyes on them, and they need to be seen. So we'd like to be able to expand that. So do I think that it's going to, it might cause a bit of trouble here? Yes, but I don't think it's any different than if it's at the hospital or anywhere else. So, yeah.
So we've got a minute left in the program. It's gone by so fast. Is there anything you want to profile in this last minute that I haven't raised?
The health fair.
The health fair. So we are going to be at the Seniors Trade Show. So that it was formerly the health fair. So that's coming up on May 14th at the Bay Shore, I believe. So we are going to have some of our allied staff and nursing staff kind of rotate throughout the day, so we can highlight all of our programs. People can get more information or ask questions that they might have, collect a flyer, and just know how to contact us. So we are going to be there all day at the health fair on May 14th.
So we encourage people to come to your booth and to talk and learn more about the services. I've really enjoyed this conversation. I want to thank you so much for being on the program and providing the update about how you are growing and changing and adding services for our community. So thank you both, and all the best.
And thank you, Carol, for allowing us to come on here and actually showcase what we do.
It's excellent. Thank you so very much. And thank you to our viewing audience for joining us today to learn more about programs, services, and resources for you and your families. Take care and stay safe. Thank you.
Connect with us by visiting our website or email us at comments@rogerstv.com.
Hi, I'm David Sherman, host of Politically Speaking. Join me for my next show, where my guest will be Ian Boddy, Mayor of Owen Sound. Politically Speaking on Rogers TV.
Everyone wants to know about everything Blue Jays.
Blair and Barker, know what's up.
Over under an 86.5 wins.
I'm going to go over.
What's the story on Blue